Erythema infectiosum, also known as fifth disease, is an infection that is caused by the human parvovirus B19. It can affect anyone at any age, but it mostly affects children between the ages of 4 and 10. It is either transmitted via respiratory droplets or via blood and blood products, and it is considered to be infectious. The most common sign of fifth disease is bright red patches that occur on the cheek, creating a slapped cheek appearance. However, when these patches occur, the patient is no longer considered to be contagious. Before the red patches appear, the patient can experience fever, headaches, myalgia, malaise, and pharyngitis. In adults and adolescents, in particular women, arthralgia and arthritis are common symptoms of fifth disease. However, there are individuals who can be infected and be considered infectious without presenting any signs or symptoms.
There is currently no medical treatment for fifth disease. Patients generally have to wait for the virus to go away on its own. However, most patients are either asymptomatic or experience mild cold-like symptoms. Therefore, whilst there may not be any medical treatment for fifth disease, the symptoms are generally quite mild and can be managed. So therefore, the best possible outcome for fifth disease without treatment is that it will go away on its own.
I'm now going to discuss the evidence-based approach that a patient or caregiver should take when approaching treatment for fifth disease. In most circumstances of fifth disease, very little treatment is needed, but in very rare cases, treatment is needed quite quickly to avoid a possible fatality. I'm firstly going to discuss treatment for a very mild severity and also give an example of a treatment approach of a more severe case of fifth disease. In most circumstances, treatment for fifth disease is not needed, and there is currently no medicine that prevents the infection, and due to this, there are very inexpensive ways to reduce the risk of contraction. This includes washing of the hands very often, avoiding people who may be sick, and also resting at home. The only medicine that may be used as treatment for symptoms such as fevers or headaches from having fifth disease is the use of ibuprofen, which is an easily accessible anti-inflammatory that can be purchased at a very low cost. An example of a more severe treatment is in a uterine blood transfusion to a fetus when the virus has established itself during a pregnancy. The use of this treatment is a rare occurrence and only used in situations of severe anemia of the fetus. Anemia of the fetus occurs by the degeneration of red blood cells due to the virus. This harms the production of red cells. The lack of red blood cells leads to a reduced flow of oxygen to the fetus's organs, which can be fatal if untreated. The reason for this treatment being the most expensive is due to the fact that these intrauterine transfusions have to be administered in a hospital setting.
As it has been said, there is no vaccine to prevent fifth disease. However, doctors are able to diagnose fifth disease by observing the specific rash on the face and body. If an individual does not show the rash but do experience the symptoms, the doctor may issue a blood test to see if it is caused by fifth disease. Most healthy people do not need treatment as it will eventually disappear. If the doctor suspects you to experience critical consequences, he or she may test for specific antibodies. This is most common for people with a weak immune system or for women who are pregnant. If a pregnant woman has been in contact with a child who has fifth disease, she should inform her obstetrician. Then, if necessary, the use of ultrasound examinations and blood tests can be used to observe fetal development.